Imagine bad medicine. What is going on in today's health? Why do we need this new health plan? Or a good question, I guess, is, do we need this health plan? Maybe we should look back at the roots of medicine. In today's guest, we're going to discuss just the basic philosophies of medicine and give some other factual information that may enlighten you, I hope. Welcome back again,
Hi,
Christopher.
John. See you again.
Yeah, it's good to see you. I guess the first thing I want to lead off with is, what is going on with the healthcare so-called crisis, and what do you have any comments upon that?
Well, my perspective on health and medicine is probably a lot different than many of the people debating it on TV, like the Clinton health plan and so forth.
Liberal, conservative, and all.
Right. My perspective is that we need to learn more about the roots of disease. Most of us aren't even interested. We want to go to a doctor to take care of a symptom, right? I mean, that seems to be our approach. And yet the symptom is merely one phenomenon in a long chain of events. Where did that start? And many doctors say, well, that's outside the scope of our practice. That's not what we do. We give you drugs, we perform surgery. That's what we do. And they all take the Hippocratic Oath. And
that is basically?
Well, that's, to be quite honest with you, I don't know the words of the Hippocratic Oath, but it's that you're promoting the life and the health of the patient.
Right, to do no harm or something like that,
exactly.
Basically.
However, I suspect there isn't one doctor in 1,000 who really knows what Hippocrates did and taught and practiced. And
for example, like what did he teach back then? You mentioned some things about breathing and use of herbs. There
were a whole series of practices. It included sauna, steam baths, teas and herbs, breathing, exposure to the sun, exercise, diet. A lot of the things that you might consider healthy living and good nutrition.
Just common sense and nothing mystical or magical.
Exactly. A lot of it is common sense. But you have to keep in mind that people are making somewhat of a science of the fact that our emotions and our state of mind do affect our health.
Right.
That is to say, if I'm constantly gritting my teeth on the freeway, there are certain liquids, certain fluids that are promoted or produced from our brain and flow through our body.
Yeah, peptoneurons. It was quoted on Bill Moyer's Healing the Mind. They talked about the same thing you mentioned, and they actually showed that to the microscope, just to back up what you're saying, yeah.
So to ignore these things, to ignore these causes, and go right away to eliminating a pain or eliminating a symptom is short-sighted. And you always can get rid of a symptom. I remember when Ronald Reagan had cancer of the colon. His doctor was on the news, and he said, "We cut it out, we cured him." And that was, I'm sure he was being honest and straightforward. That's the way he sees things.
Right.
By physically cutting something out, you cure it. And no doubt you do remove that symptom.
Right.
Okay.
But what caused the tumor, I guess, is the essence.
Where did it come from? That physical symptom was was one act in a long chain of events. Will that happen again? Now, many people don't care.
But likelihood is quite common, isn't it?
Oh, it's very common. Many people do not care, and that's their prerogative.
Right.
To go to the doctor, let the doctor treat the symptom. Give me a drug, cut something out.
The cult of medicine, as you mentioned.
As long as you're well aware that that's what you're doing, I think it's fine. Be apprised what the medical profession is. Now, many religions and cults spring up as a result of a desire to eliminate pain or to help produce happiness.
Right.
And in a way, people go to one cult leader or another. And I have some pictures of some. Here's one guy. He gave his followers. I'm not sure where I should hold this. He gave his followers a Kool-Aid as his final medication, right? The suicide Kool-Aid. Here's another man. He founded Ambassador College. But I regard a lot of these folks as cult leaders. They offer promises to their followers. People follow them. They practice their medication. Here's the Pope, another one. And I have nothing against these individuals if they uplift your life by following them and practicing what these cult leaders say and do, then that's fine for you. I'm not discrediting them. Here's one that we all heard of recently. Tragedy in Waco. Okay? Now, my way of looking at it is that people who simply go to the doctor, you may not go to these cult leaders, but you may go to the cult priest who wears a white robe. Mm-hmm. Instead of a crucifix, he wears a stethoscope, and he prays to Amma, his god. Do you know
what's Amma?
The god Amma that they all pray to, the AMA, right?
American Medical Association.
Right. I'm kind of kidding, but the fact is, in all the ways that you look at a cult, the way we treat doctors
is the same
as divine. You know, go to the doctor and the doctor would take care of me. It really is dangerous. Mm-hmm. Because, well,
we're not taking responsibility for our health. Is that what I'm kind of?
We're not taking responsibility to do what only we can do.
Right.
You know, it's sort of like thinking the police can stop crime. Well, ultimately, crime has to be dealt with on a local level by neighbors choosing to stop it. Police come in and clean up after the fact. Doctors can't really make you healthy. They can tell you what to do, but you have to do it. Right. And the fact is that most conventional doctors are trained in medicines and surgeries. And I'm simplifying, of course,
right.
But you need to be aware that that's what you're getting into. And
wasn't it, as you gave a statistic of how much they believe it was, I think I have it here, 70% of all illnesses doctors believe that they cure. Is that correct?
Well, one of the worshippers of Amma did say that their practitioners heal 70% of all diseases with surgery and drugs.
And what's the real?
Well, another statistic that I heard that contradicts that. This was a nationwide study, computer study they did, just comparing data. They found that 81.7% of all sicknesses just heal themselves with bed rest and water. So one of them is wrong. They can't both be right.
What's this idea of, I guess it's Arnold Pike's viewpoint on nutrition?
There's a long-standing show that's been on television called Viewpoint on Nutrition. Mm-hmm. Arnold Pike is the host, and he says that he's a doctor of chiropractic. He says that at least half of the medications on the market are completely ineffective, which should cause you to wonder. I mean, there have been many tests done with placebos, and often the placebo works fine because we believe we're going to have an effect. Well, we do have a lot of power that we don't give ourselves credit for.
Right.
But the placebo works because we believe it's going to work.
So it works.
And in many cases, it's a condition that would have taken care of itself anyway.
Right.
Or the doctor really doesn't know what it is. And I'm not trying to paint with a broad brush that all doctors are ignoramuses or something, not by any means.
Right.
But the fact is, much of medicine is very exploratory. In terms of drugs, even in terms of experimental surgery techniques.
Yeah, you mentioned something like a dean of Harvard Medical School and some statistics on him.
This I saw on 60 Minutes. He was interviewed some years ago.
Okay.
And it really sort of made me shudder when I thought about it. This is the dean of the medical school. He said, half of what we taught our medical students in the last 10 years is wrong. And then that should give you pause to wonder right there. And he said, but we don't know which half.
That's what he said?
That's what he said. We don't know which half. In other words, we're always finding new things, finding that some premise that they believed about the way the human body works was wrong, or that it was slightly off.
Now, you gave some very good examples of stars, I guess, or people we consider very popular people who have died basically because of the same premise.
Right. There was a statistic of, I think, 50,000 people a year who die from the effects of the anesthesia for surgery. And I believe the figure is a little bit higher from complications arising from the surgery, not the surgery itself. It's kind of like, yes, the surgery was a success, but the patient died. A few famous examples, you've heard that, right?
Yes.
I mean, that arose, I believe, from the Civil War days or thereabouts. It's probably pre-Civil War, when people did a lot of experimental surgery. Surgeons were something different from today, actually. And many times the surgery was a success, but the patient died. And so what's the meaning of a success?
Like in the case of Steve McQueen, that's another example I just read about in the book I'm going to show later, which he actually is the same thing.
What did he die from?
He died of cancer.
Mm-hmm.
He started taking lyrical treatments, and then the doctor convinced him to have surgery. Well, surgery was successful, but they don't tell you that the surgery actually spreads the cancer further after they cut it out. And he died.
Interesting.
This is interesting, just to support, it's called Murder by Injection by Eustace Mullins. And he talks about some of the things you mentioned. He mentions that they did a study with the American Cancer Society, and they found through this study that people who did not have any treatment at all live 4 times longer than those people who received chemotherapy and radiation after being diagnosed with cancer.
Mm-hmm.
And this study was done with some 4,000 or 5,000 different patients, and it was just amazing. So you're better if you didn't have any treatment at all, you'd live longer.
I know that it's a topic that people will always debate. This side versus that side.
Right.
My mother is a nurse, and she sees patients who are treated with chemotherapy, and her overall observation is that many times they're in more pain and
suffering
and suffering than they would have been otherwise. Now, let's face the fact that we have a limited lifespan.
Mm-hmm.
Okay, people want to do all sorts of things to extend that. The way to do that and the time to do it is when you are younger, to live your life a certain way.
Mm-hmm.
But sometimes many of these things that we resort to are, really are making it worse, like you say. Miles Davis, the jazz musician, he died from a complication of some surgery.
Was it Jacqueline Kennedy you mentioned?
Jacqueline Kennedy, if you read carefully, she did have cancer, but it was a complication from the surgery that they say caused the death, as well as this
Andy Warhol.
Andy Warhol, sure.
What happened with him?
Again, he probably would have died from his illness, but he had some surgery, and I believe it was a reaction to the anesthesia,
right,
or some complication from the surgery. I don't recall the exact detail, but it wasn't the disease itself that killed him. However,
that's interesting.
However, do people rise up in protest against the medical profession when all these people die? Of course not. They say, well, that's just the way it is.
It's a cult, like you said, because we do, if you look at the media and the way people talk, I'm at my school as a teacher, they worship it. They believe every word is gospel truth.
We say to ourselves, they're doing the best they can. We've turned our reasoning process over to them all too often.
Right.
We've let them make the decisions. Mm-hmm. Why can't you make the decisions about your body?
That's right.
You will be convinced. You don't have the PhD. You don't know what I know. Just believe me, this is the best thing for you. You go to another doctor and you're going to get another opinion.
That's true.
So if you're going to go to doctors,
right,
I would strongly advise you to get many opinions about what you're about to do. Now, in spite of the fact that tens of thousands of people die every year from going to the doctors, as well as getting diseases in hospitals that they wouldn't have gotten otherwise.
Right.
In spite of that.
You're talking about bacteria and stuff, and maybe you want to say a little bit about that.
Sure.
That's interesting.
In hospitals, there are breeds of bacteria that grow because it's such a sterile environment from all of the antiseptics that are used.
To clean.
The only bugs that survive are the powerful ones. Mm-hmm. So you've got strange new ones in hospitals. And I mean, it's made the newspapers. There are a lot of people who get these diseases that they never got before. They got sicker when they went into the hospital. And
actually, from what I understand, they are more resistant to almost any type of antibiotic that exists. It was in Newsweek magazine.
There are certain ones like that, yes.
That are almost resistant to everything they have.
And there are cases of X-rays being read backwards. I'm not saying that you have to be frightened, but I think you should really investigate what you're getting into when you get involved with the Medicult, which is my term for it. It's a cult in every sense of the word. Now, in spite of all of the deaths that we somehow say is okay.
It's okay. It was.
What happens with?
They did their best.
Yeah, that's what we tell ourselves. But what happens then if somebody says, well, I'm going to pray?
Yeah.
Okay, now I have no objection to that personally, but there was a Christian scientist who said that they were going to pray for their daughter. I don't know, to be quite honest with you, I don't know what they meant by pray for the daughter. But it meant something to them. The daughter died. And they were sued because, I mean, why were they sued? We're in a state today where people believe, we've been brainwashed. We believe that you're mandated to go to the services of that Medicult when your body is sick.
And if you don't, you are responsible to the medical.
You're irresponsible.
Irresponsible.
Some people argued that, well, if it was the parents' body, that's fine, but they did it to the child, and I could understand that argument. But how many cases of so-called spiritual healing or attempted spiritual healing, whether you believe it or not, how many such cases are there?
Many.
Well, I mean, there really aren't many compared to the vast numbers of deaths when people do go into the hospitals.
Right.
I mean, the numbers are nothing by comparison. Plus, if you're a skeptic, you know, you keep in mind that 81.7% of all of the illnesses and diseases will heal themselves. So you might just say, well, they prayed. If that's what you want to believe, they prayed, and they would have gotten better anyway.
So didn't you have an article there? You had that one on the prayer and so forth that was very interesting.
I've got quite a few. Here's
okay. I'll hold them up for you.
That's kind of a financial aspect there.
Okay. As far as financial and what?
Right. I do have 20% of Medicare claims wrong. That's a big area of fraud within the hospital industry. Is all of the overpayment. And I have here's another one. Half of the cesarean operations in the U.S. are called unnecessary.
Over half of them.
And I've got loads of these. Man accused of practicing medicine without a license. You know, I have files and files of these, John. And again, I'm not trying to make a case.
To add on to this, something that most people don't know, but the first two founders to the American Medical Association, as quoted by Eustace Mullins from his research, never had a medical license.
Well,
most people don't know that they were journalists and they practiced without a license. One of them was a homeopathic doctor, which used to be the mainstay of medicine until the conventional medicine came to be.
Right.
So it is.
You know, you got to keep in mind that many of the practicing, here's the one on Christian Science, by the way, many of the practicing doctors have, according to one study, have licenses that are not valid anyway.
Right.
So even having a license isn't all that it's cracked up to be. I mean, if you're going to go
so
to
there's no assurances, basically, except for yourself taking responsibility.
That's it.
Yeah.
That's it. Don't assume that because one person says everything is on the up and up that it is.
Right.
You need to ask questions. You need to become informed. Look how informed people get about their car, right? Using the right kind of oil. You got to have these kind of tires in the rain. And look how uninformed we are about our bodies.
True.
And that's totally within our control.
Right.
So, you know, one of the things that I wanted to share today, if there's time, on the classes that I teach, I try to show people some of the natural remedies for everyday problems that arise.
Basically, in other words, this is medicine, and if you want to look at it in that term, to heal thyself free.
Exactly.
Or practically.
Keep in mind that even if you take an herb, you're still dealing with a symptom.
Right.
It's no different from going to a doctor and getting a pill.
That makes sense, because you're still addressing the symptom.
You're still dealing with just the symptom, but it's within your control. Right. And again, I leave it up to the individual to use it or to not use it. I mean, the people will argue one way or the other. Here's some willow bark. Here's the young willow plant. Do you know what willow's role is in medicine?
That's a good question, okay.
The bark of willow, the inner bark of willow is where we got salicylic acid, which is aspirin.
So this is a derivative of aspirin. In other words,
this is where aspirin came from originally.
It's derived from.
Now it's all produced synthetically. But you could go on any trees in the local mountains and get bark, and you could have your own aspirin.
That's interesting.
So instead of take 2 of these and call me in the morning, the doctor could say, take 2 strips of bark and call me in the morning.
And would you chew that, or how do you?
You would make a tea from it.
A tea.
You would soak or gently cook the bark in water, and the water actually becomes a little bitter, and you would drink it as you would take an aspirin.
Oh, that's amazing.
Yeah.
Now you have a lot of other ones. Maybe we could go down the list here.
Everybody ought to know about this plant.
This is
Do you know? Do you remember?
Aloe vera.
It's an aloe vera. And this is probably the best remedy for cuts, bruises, burns, poison oak rash. An interesting little story about poison oak. I used to get poison oak real bad. I don't get it anymore because I eat the leaves every year. I had heard that Indian tribes locally would eat the leaves and they became immune to the poison oak rash. But before I was immune, this was the best curative that I found in the natural world for poison oak rash. My very first outbreak, however, probably the first 1 or 2 outbreaks, I went to a doctor and I was given hydrocortisone pills and sprays.
Right, which I've had before too.
Which took about a week for it then to cure. Using some of the herbal remedies, it only took 7 days. There's a joke buried in there, John.
Yeah, it sounds like a week and 7 days are the same.
Right. But in any
In other
event,
words,
this is better than hydrocortisone from the sense that hydrocortisone, if taken over long periods of time and taken regularly, actually weakens your immune system, so you become more dependent on it. One doctor.
this is not addictive,
No, I mean that just dries up the skin.
right?
You
So it
can use
heal.
it for burns, cuts, anything like that, any skin conditions,
Right.
rashes. My mother has used it many times on people who have had rashes. She's used it on pet cats that had, cuts and bruises and burns on. In one case, it was a tight collar, and the person who had the cat hadn't loosened the collar, and the cat actually had a sore to the bone, and she put the aloe on it, and it healed up the wound. So some of these other herbs I brought, people will recognize. Actually, onion. Onion. This is the lemon.
Okay, lemon.
Lemon is used very much as you would use vinegar. It makes a very good drink. It actually protects you from the heat, protects you when you're under stress. It has a lot of vitamins and minerals. I learned about vinegar when I was taking a survival training school, vinegar and lemon juice. And when you take vinegar, you want raw apple cider vinegar. You make it into a beverage, and it's very good when you're in the heat. Garlic, of course, is good for all sorts of things. It
Right.
helps reduce high blood pressure. It helps reduce cholesterol levels. And there are whole books that have been written on garlic.
Right, I've seen it in the nutrition magazines all the time.
Everybody should include garlic in their diet if they don't already do so. And when people overeat during the holidays, they take Pepto-Bismol and they take Alka-Seltzer, right?
Right.
Instead, you could take California bay leaf instead of Alka-Seltzer for tea.
Oh, this is the bay leaves.
Right, and for indigestion, you could make a tea from Episode.
What's that? Isn't this lamb's quarter? No, this is not lamb's quarter.
It's a lamb's quarter relative. Episode is from Central America, and it's used for indigestion or gas.
So these two combined are very similar to Pepto-Bismol without any of the...
Pepto-Bismol or Alka-Seltzer, without any of the
That's
side
amazing.
effects.
Yeah, that's funny.
And of course, John, all of these herbs, if you study about them, they have medicinal properties that people can learn about. This is a common book, Michael Moore's Medicinal Plants of the Mountain West, if you're interested in the medicinal properties of wild plants. It's a very good book. Somebody gave that to me as a gift. I have medicinal plants listed in my book, Guide to Wild Food, although it's not primarily about medicinal plants. It's about foods primarily.
Right, all the different types that you can eat along with the medicinal ones. You have a few more you want to demonstrate here?
Well, sure. This is a prickly pear cactus pad. Would you like to hold that? Be careful because of the stickers. Now, you've eaten that on the outings that you've attended with me.
Correct.
So this is a case where you can get your food and medicine at the same time.
What is cactus good for?
Well, as a food, it's good in salad. It's good added to omelets. And when you peel it and eat it raw, it tastes like a sour green pepper. And it actually helps you if you have diabetes.
Oh, it does?
Now, I'm not claiming that it cures diabetes, but I believe the explanation is that it helps the body produce the insulin naturally that you need. Now, certainly if a diabetic is watching this, you don't want to just rush out and start eating cactus without doing some research.
Right, but it is an enhancer.
Do you recognize what this is from our past
This looks
classes?
like lamb's quarter. Lamb's quarter has medicinal quality. I didn't know that.
Well, I call that nature's vitamin pill or mineral tablet. This is one of the richest vitamin and mineral sources found in the outdoors. It's found worldwide. It's a rich source of the B vitamins, rich source of calcium. It's rich in practically everything. You can eat it in salad or spinach. And I also have a rose. What kind of medicine or food do we get from that, John?
Rose hips, vitamin C.
Rose hips, second richest source of vitamin C in the world. So if you don't trim your roses off, your little orange, red fruits will develop, which you can then collect and eat for vitamin C.
That's amazing.
Yeah.
Well, is there any last comments you'd like to make about medicine and it's the whole idea behind it, because we're kind of running short?
Well, again, I think that it's important to familiarize yourself with your body. When you have illnesses or sicknesses, they're telling you something. They're a sign to you. They're a message to you. What does that mean?
Don't suppress the symptoms completely, because they're telling you how to take care of yourself.
Well, exactly. Exactly. If you can learn what that message is, you can learn a lot about your inner workings as well as your body.
Well, Christopher, thanks for coming on the program
Thank
again.
you, John. I'm just glad to be here.
Yeah, it was a lot of good information. Imagine bad medicine. It's time in this country, instead of worrying about who's going to pay whose medicine, that maybe we should take care of ourselves. Because it comes right down to it. No doctor, no bureaucracy is responsible for us. We're responsible for us. Thank you. This has been Imagine.